So what are the pre-operative investigations you have to undergo before you go ahead with the nose and sinus surgery? Firstly, you'll have to undergo a series of blood and urine investigations as part of the major surgical profile. The reports take anywhere between a few hours to a day to reach you. Once you get these major surgical profile reports, you'll be visiting a cardiologist. The cardiologist will take your detailed history, will examine you, and to assess your cardiac fitness will perform an ECG and 2D echo. Sometimes he may ask for a treadmill cardiac stress test. Based on your history, the findings and the investigation reports, he will give cardiac fitness for you. With all these reports, you will be visiting your anesthesiologist for the pre-anesthetic checkup or PAC. If you have any medical conditions like diabetes, hypertension, hypothyroidism, other heart, kidney or other ailments, you will have to take the reports, investigations and the medications you consume on a daily basis along with you to the anesthesiologist. If you have undergone any surgeries in the past and if the discharge summaries are available with you, it will be really helpful for the anesthesiologist to have a review on them. So the anesthesiologist will examine you, will check your medical reports, surgical reports, and based on the findings will give fitness for the anesthesia. If the anesthesiologist finds that any of their findings or your investigation reports are not in line, they may seek further clearance from other doctors like a gastroenterologist, pulmonologist or an endocrinologist. So if they give fitness for surgery for you, they may suggest what medications you have to take, what medications you should not take in the days leading to the surgery, and also will give you other instructions you have to follow before coming for the surgery. So what are the pre-operative instructions you have to follow in the weeks leading to the surgery? If you have a habit of smoking, you have to stop smoking at least 3 weeks to a month before your surgery, because smoking will cause scarring in the nose and also will hamper with the healing after the nose and sinus surgery. If you take any herbal medicines like ginseng, ginkgo biloba or ginger extracts, you have to stop taking these medications at least 2 weeks before the surgery, because these will cause a lot of bleeding during the surgery. If you are a cardiac patient who is taking blood thinners like clopidogrel or aspirin, you have to stop taking these medications at least 72 hours before going ahead with the nose and sinus surgery. Again, because these medications will cause increased bleeding during the surgery. What are the pre-operative instructions you have to follow on the day of surgery? You will have to stay nil by mouth. That is, you should not consume any food or liquids at least from 6 hours before the beginning of your surgery. This protocol should be strictly followed, and the anesthesiologist may postpone your surgery if you do not follow this. If you are a hypertensive or a hypothyroid patient, you should take your medication as usual with small sips of water. If you are a diabetic, however, you should refrain from taking your medication on the day of surgery. You have to carry all the medications which you take on a daily basis along with you. If you're an asthmatic who uses inhalers, it is advisable that you carry the inhalers also along with you. You have to make arrangements so that a friend or a family member can stay with you during your entire admission in the hospital, which is usually not for more than 1 night. You should also make arrangements for someone to drive you to the hospital and from the hospital after the surgery. Sometimes if the anesthesiologist feels that your anxiety is causing fluctuations in the blood pressure, they may suggest an anxiolytic like alprazolam. This alprazolam tablet should be taken on the night before the surgery and on the day of surgery with small sips of water. This medication can cause sedation for you. Once the admission and consent formalities are completed, you will be shifted to the pre-operative ward. In the pre-operative ward, the anesthesiologist will again do a review pre-anesthetic checkup and give fitness for your surgery. They'll place an IV cannula in your vein. Once you are shifted to the pre-operative ward, they will give test doses for the anesthetic solution and the antibiotic solution and see how you're responding to these particular medications.